friends, welcome to CEC Gurukul live lectures. Dear friends, this is a session on career counseling called Pratibha Samvardhan, and today we are talking about public health and public policy, and public health and public policy are interrelated. We have discussed a lot in our previous session and you have gathered lots of information how public health and public policies are connected and how good career it could be. Now you might be wondering what are the different areas where one can work on. Friends, for this discussion we have with us in our studios Miss Sejal. Miss Sejal is a career counselor and she is currently working with renowned career counselor Jitin Chawla, and we believe that her insights would definitely help you out in choosing the right career. So this is the right time to watch us and this is the right time to think your future in this course too. So Miss Sejal, welcome once again, and thank you for giving us the wonderful session earlier, and we believe that this session also is going to be thought-provoking. Now we, after doing our 12th, are always confused what to do next. Sometimes we are unable to understand our potential. We have a lot of potential, but we don't have people around who could teach us, who could guide us. No, you have this thing good in you, and you can make your way forward. Some students are actually very good when we talk about their intelligence. They have this ability to understand the world at a large, and I believe that those people who have this ability to understand the world, the people, or I could say those very humane kind of person could make their way into this particular field. So now after 12th, how I can think and how I can go in this particular area?
Okay. So for example, if you've studied class 12 with either humanities or public, like the biology section, after you've done your core biology PCB, then you can move to public health sector. But you've done your humanities, then you can move to policy making. Now when I talk about public health, in public health you can itself become epidemiologist. Now you're understanding the diseases, you are telling the policymakers that these are the things that we have to take into consideration, and by them working on it, because of these diseases we have to formulate the laws accordingly. Now after doing public health, you can work in a like NGO, UNESCO, or at a local level, understanding the needs, and then work as a healthcare worker. Now becoming a healthcare worker is typically easy. So you do a specialization after public health in health sciences or life sciences. You are getting the understanding of basic components of healthcare, biology section, life sciences, healthcare as a core. So then you become a person who will be understanding the patient needs, the community needs, the needs of the rural areas as well as the urban areas. Now when you set up with the epidemiologist, then you've set up with the healthcare worker, then you can also work as a urban manager. Now there are hospitals, there are big institutions, organizations that are taking the land for the commercial use to set up these organizations in concern with the public health. You can become this urban land manager to understand where you have to put this each land into consideration, keeping in mind if there is a rural area nearby and there is a sanitation being needed. So you can set up a sanitation requirement NGO there. If you are looking there is a need in a nearby area for clean water supply, you can use that area, or a rural area or an urban area. You can manage that land in consideration with what is being required in the nearby market. Now when I talk about humanities field mein you can become a policymaker, which we already talk about, just policies formulate karni hai. You can become a foreign affairs. Now there are questions around the globe whenever pandemic arises, whenever there is a disease, there is a consideration, there is something called the debates, arguments. So you can work as a foreign affairs consultant, where you will be advising about the population, keeping in mind what they need, what the supply is, what they are getting from us. So you are tackling it at a global level now. But when there are like concerns about analyzing the policies at an international level, then you can consider international relation consultant. So now the policies तो अब हैं गवर्नमेंट के पास, NGOs के पास, बड़ी बड़ी ऑर्गेनाइजेशंस के पास, बट उनको फॉर्मुलेट करना, उनको एक्सरसाइज करना, उनको चेंज करना, वो किसी को करना पड़ेगा. सो दैट for that you can become international relations consultant. Now if I understand these are all interconnected, तो policy making के बाद for bachelors you can choose pol science, you can choose international relations. So these are some of the careers that are available, which will get like change according to the demand of the NGOs or organizations.
So these are the varied areas
Areas.
with us, and one can apply and one can go for the higher authoritative jobs too if one has the degree in this particular area. After clarifying the examinations, one can hold a prominent position in the government sector too. Now the question arises, any student, as you said, one who is from humanities background or from the other background can go for such courses. Now my other question is, if somebody is from the another background, for example, say if somebody has already been studying in the area of engineering, for example, and now the person says, no, I want to be into this particular field. So does he or she has this privilege to?
Of course. The engineering person is, of course, in itself understanding the data by the time, because he is doing a PCM in his course, understanding the statistics, how it works, understanding how the data can be interpreted and used into the real life. So we've already gone through these all subjects. He has touched all of these subjects and in a deeper manner. So he is more precisely be able to work with maths, analyzing data, because of the AI, to be honest. Now policy makers सब कुछ बना तो रहे हैं, but then AI is formulating it in their own manner, because we are sharing the content with the AI. They are formulating it in a way and in a very intellectual manner कि it is then deviated towards how the public wants it, how the public is challenging the environment, how public wants कि हमें कैसे protocols चाहिए, कैसे rules चाहिए, regulations चाहिए around us. So AI का demand, because the digital market is increasing, the PCM students will be able to understand it better, will be able to formulate the laws in a better way, and will be able to serve the country in a better way, or globally as well.
Vice versa, students from the humanities or the social sciences background, anyone, if one wants to be in this particular field, it could be a good career for them. Now another question arises, what are the courses available? How one can choose a course? What are those courses?
So bachelor's level pe, it is that's what I said ki thoda sa we have to start touching up, because these things become the specialization. But at an undergrad and postgrad level, these are the specializations already available. So you can target the universities like South Asian universities, you can target the universities like OP Jindal University, University of Mumbai, you can target Symbiosis universities, you can target Christ universities. But now, if you have to think कि मेरे को बिल्कुल core subjects उठाने हैं in public health and policy making also, so there are like a lot of abroad universities helping with that, because they have a core public health subject. So for example, if I talk about abroad universities, there are Harvard University, there is QML University, there is other universities like Stanford and other top universities that offer this core subjects in public health and policy making. But when I talk about humanities ka course that you can pursue after 12th in general, you can go for international relations, which will be available, or policy making, which will be available in Jamia Islamia University. It will be available in Christ University. It will be, the international relations subject will be available for you in OP Jindal University. So international relation wala subject is core available for you guys. TIS University, Tata Institute of Social Sciences, so they have a core undergrad plus postgraduate degree with them. Same Jamia Islamia have a postgraduate plus undergraduate degree with them. So core subjects to have, but then if you have to touch up basically on, like, you have to just become policy analyst in certain, then those degrees might not be available. Then you have to do a specialization again after an undergrad or postgraduate level. You can do a diploma, or simultaneously, do not underestimate the power of networking. So you can network more, you will be able to get a hands-on experience from practical basis, and then at least you have a political science ki degree, which you can combine with the practical experience of becoming a policy analyst, because you might have worked with an NGO, which will suffice your degree to work in an NGO or work with the local community or at a global level.
So these are the areas where one can have a career. Now, if one wants to study abroad and one wants to have a degree, because we always wanted to be labeled. So do we have courses abroad also?
Yes, it is available, but then again there are certain requirements. So for example, if you're going abroad, there are certain requirements like English proficiency test is being needed, basic requirements. You have to show your academic score, you should be good at profile building. Now what I talk about profile building is, you should understand that they will not only consider your academic part, they will also understand what have you done apart from your academics. So they would like you to know कि अगर आप policy making में interest interested हो और policy analyst का course उठाना चाहते हो, you should have worked with an NGO, you should have worked with an organization. Why I'm saying this? Because they would get an idea that you're not doing or applying for this degree just for the sake of it, but you are actually interested and it will be a fruitful degree for you. So once you have like worked with an NGO, you've got a practical experience, you've got a good academic score, you've got a English proficiency test which could be IELTS, TOEFL, Duolingo. So basically to check that you are good at English and you can come from a native Hindi language and coming to study for an English language course. So it would suffice. So these are the basic requirements that is being required, and then apart from that you can also look for internships, because ultimately the more internships, the more outgoing, the more volunteering activities you have, the more communicable you become once you apply for a policy analyst. Because at the end of the day, policy analyst का काम क्या है? They are communicating, they are making a persuasion technique that these laws has to be formulated. Why is the factor? Why? Because people want it. People are thriving for it. There is a need for sanitation. There is a need for good water supply. So you have to keep your point, and you can only keep your point in becoming policy analyst once you know how to communicate. So yeah,
very true. The communication is the another important ingredient and the key if one wants to be in this particular area. So what else do you think that you need to tell the students, because this is opportunity which helps you to get connected to the students who basically wants to be into this area. So any other point which you feel so that is required to be explained at a stretch?
Okay. I believe if you are looking for public health or public policy, you should be good at communication, first key point. Second, you should be open-minded. So you cannot think of one question and then you forget about the other, but you have to make laws in a generalized manner, in a basic local level, and then when you are moving up to higher hierarchy like state level, then you also have to keep a generalized manner, keeping in mind the local community as well as the state level community. So what you are doing here, you are analyzing. So what happens is communication is the key, but data analysis is also another key that will help you. So you have to be very practical. You should be good at research. You should be good at analyzing things in a way keeping in mind how promoting the health can work, prolonging life can work, preventing diseases can work, because we still have hospitals. But at the end of the day, your mindset should be, we have to prevent diseases before they happen. So infrastructure is there, hospitals are there to serve us, but the more we prevent, the more cautious we are, the more we'll serve towards the community, the more open-minded we are. And at the last, never underestimate the opportunity to network. The more you network, the more chances you will get to analyze how people are in a particular society, what they are thriving for, what is the growing demand. And so it is just about the demand and supply. The demand is for some policies, keeping in mind the biology sector, keeping in mind about the analysis, and then you are supplying yourself, keeping in mind कि मेरे को क्या supply करना, the policies, the laws, in consideration कि उनको वो सब मिले. So you have to be very empathetic also at the end of the day. So yeah.
And knowing your people, knowing your community is the most important thing. Until and unless you you don't have that fire to know people, the condition of the people, anything or everything which they are going through, till then it is not possible for you to understand what is the problem, what could be a problem, and once the problem is identified, the mystery is solved. Mystery is solved before it is going to happen. So if one has this keen desire, he can make the way.
So basically when you use the word predict, so I got of another career which can be called as computational biology or bioinformatics, which is another career. India mein it is called as bioinformatics, Bahar it is called as computational biology. What is that? It is again related to epidemiology. So what you are thinking in terms of that subject is, once you've done PCB, you choose a specialization in the subject, you will understand what you will be doing in this field. You will be doing how many lung cancer cases will be there in Africa. So you are again predicting. So you have to be very open-minded with the concepts, with the revolution, with the people, the population, globally, locally, community-wise. So you are just working for the welfare of the society, and trust me, this is the growing demand right now, because the welfare of the society and the sustainable goals are very important, because the global crisis is increasing day by day. So yeah.
So this is the another important career you have stressed over here. Those people who are very much into research and those who love doing researches, for them this could be a very good
Research
career
analyst careers,
research. Those who wants to be academically also they want to grow. So they can pave way for the others by providing the research papers and the dissertations that would help the students.
Again, they will provide it. They will do their research. They will provide the data to them. The policymakers or the data analysts will analyze it, formulate the law. So all of these things are interconnected with one another. So research analyst was another category that you could choose if you do not want to work with core biology, data analyzing. You just research about it. Put forward your thoughts in front of the analyst or the epidemiologist. They will take care of everything afterwards.
How this industry is connected to the pharmaceutical industry, because pharmaceuticals is another important branch if you talk about the medical sciences or the health services. So one can find any option in between?
Yeah. So one is the computer aided drug design. What will happen is epidemiologist ne bata diya what the diseases are happening, what you have to do to suffice these diseases. Then there is a need for another component which we will use as computer aided drug design person. What he will do is he will understand the diseases, he will understand and work on the genomics and the genetic factors, produce a component which will work with the genetics, understand how this is in relation with the complex dynamics of DNA, genetics, and then this drug design will then be taken care by the policy analyst if it can work. So the mediocre would be the computer aided drug design person. So the epidemiologist told something, the drug has been created or the component has been created, it will now be checked or ticked if it can be used by the population, by the policy analyst itself.
We sometimes hear the news when we because everybody of us wants to know what is going all around us and and basically if we talk about the Indian scenario or the human scenario, we want to know what is going to happen next, what is there in the store in future. So many times we read news and we say the scientist says that in the forthcoming years this could happen, this disease or this virus can affect us. So is it a part of this area only where we research and find out ऐसा हो सकता है?
हाँ. So what computational bioinformatics persons are doing, they are understanding and predicting कि lung cancer के कितने cases आएंगे और अगर वो आने वाले हैं तो उसके लिए computer aided drug person should work on it so that we at least have the vaccinations, the drugs to like surpass it. And then we should also work with the epidemiologists that how many cases do we think that will come in the coming future years. So for example, if there is a lung cancer or maybe there is some cancerous disease or when the COVID happened, so what happened? Epidemiologist ने बताया कि ये ऐसी disease है, this is working in this, you have to understand that you have to use only these vaccines and you have to also understand that you have to keep your face covered, you also have to understand that you cannot move out, you have to be in quarantine. So these were the policies. But then these policies were only aimed by understanding what the epidemiologist wanted, and then computer aided drug design made that. Now the computational bioinformatics was the person who predicted it कि ये कितने cases आएंगे, कैसे आएंगे, कब आएंगे, कौन सी population को ज़्यादा affect करेंगे, rural में ज़्यादा आएंगे, urban में ज़्यादा आएंगे, Europe side में क्यों effect ज़्यादा हुआ. So that was the person who was predicting all of these things.
Because we from the very beginning when we were a science student and we used to study, and there were many papers that this disease is particularly found in this part of the country, this disease is usually found in this part of the country, the people of this country are not affected by this. So they are the people working. Now from that I mean from your talk I could perceive out, yes, this is the reason and this is the source from where we have originated this thought, how people work silently, and after some years we tend to realize, oh, this is how people work and this is how it becomes the news and we present our views. So this is the scenario you have explained to us in detail. Now talking once again about this particular career, what are the skills basically one requires, what need to take care of? Because alone passion cannot help you. You need to have certain skills too. Sometimes you develop those skills, sometimes you have those skills, and sometimes you polish those skills. So what do you say?
For me, the skill set that you should have, हर करियर के लिए पॉलिसी मेकिंग के लिए स्किल सेट अलग होगा, एपिडेमोलॉजी के लिए इट विल बी डिफरेंट. सो इफ अ पर्सन इज गोइंग फ्रॉम बायोलॉजी सेक्टर, then he should understand biology, genetics, genomes, DNA, the complex molecules, how these things work, how you will be working with the computer-aided drug design, how these drugs will be meant, how the biological system will impact these complex systems, how they will be interconnected. So you have to work with all biology aspects. So you should be good at biology, understanding biology, and what are the terminologies that are being affected with the disease upcoming. So for biology it is different. When we talk about policymakers, they should be good at statistics, of course. PCM ke baad ja rahe ho, then it is wonderful, like flower field for you. Why I am saying this? Because you know how data analysis work, you know how you can predict the analysis and then tell the policymakers, you know how these statistics will work in the coming years, you would be able to predict the data. So for PCM it is different. When you're going from humanities background, you should understand that the more you understand the environmental health, the more you will be able to make the policies. Because unless and until you understand the mindset of the people, along with the environment health, along with the some rural areas ki problems, urban areas ki problems, crowd, population. So you have to keep everything in a generalized manner, local level, at a different hierarchy. Only then you will be able to create policies in favor of people, in favor of the diseases, in favor of how things you can formulate. So for humanities it is different, for biology sector it is different, but for also for PCM students it is different. But at the end of the day, 3 of the courses ke liye, this is an open sector, because which is why I explained everything is interconnected with one another.
Very true, very true. Now, one of the other important aspect which I would like you to include, we talk about the internships or the programs we used to, adopt while doing a particular course. Do they really help when you talk about the public health, the students going to the site areas, or those students who are attached with the NGOs and working at the grassroots level? Such kind of practices would definitely help us if wanted to be a policymaker or to be a public health.
Yeah. So now why I tell internships, volunteering is very important. Why I say this more often is, जितना internships करोगे, जितना volunteering activities करोगे in NGOs के साथ, the more you will realize कि what the people are suffering with. So the more you work with them, the more you will realize कि यार there is a need for tobacco prediction ka. So the smoking is happening a lot in this sector. So I need to make laws in the smoking sector. So before you have a zest of 2 to 3 months of internships, volunteering activities with these NGOs, you will understand which department or which area needs what biological system, needs what policies, needs what things that can be changed into the society. So the more you are working practically and have a hands-on experience, the more fruitful this career will be. So you can work with UNESCO, you can work, there are multiple internships online available with UNESCO, WHOs, there is multiple internships available with the United Nations. United Nations in itself says that I have a third rule called good health and well-being. I want to decrease the maternal mortality rate in rural areas. So they are working on sustainable development goals. You can work with them. They will be more happy to have people who are working towards the country globally at the country level as well. You can see the Center for Disease Prevention. They also have a lot of internships available with them. Anyone who is looking for epidemiology, they can work with the Center for Disease Prevention. So yeah, you have to work on the internships, you have to volunteer as much as you can. The more you collaborate with the NGOs, the more understanding you will build, how you have to work for the people, work in the favor of people, work for the community, social welfare of society. So yeah.
Definitely, it will help you grow as well as help your society to grow too. So, Ms. Sejal, thank you so much for giving us this wonderful session, and we have in-depth knowledge about the topic. The topic we have heard many a times. Okay, we talk about public policy. Yes, public policy. We talk about public health. Oh yes, we work for the public health. But how people actually work for public health, it is clear today.
Today,
So we would like to thank you for giving us this wonderful session, and we believe to have more and more sessions with you like these.
Yeah.
And it is going to be our privilege to having you again here in the CEC
Likewise,
studios.
Gurukul, ma'am. Yeah,
So,
thank
dear
you.
friends, we believe that you might have gathered lots and lots of information, and this information would be a torchbearer in your life. It would be helping you, as well as with the help of this information, you would be helping your friends too to make a career in this particular field. And we believe that you would be successful too. And afterwards, if you feel so, you have any question or suggestion or feedback, then do write to us at cecgurukul.live@gmail.com. We would love to solve your queries, and we would love to adopt your suggestions too. And we are going to meet again next Thursday and would be discussing on another important topic related to your careers. Till then, take good care of yourself. Thank you so much.